My name's Dallas Ray. I'm the Director of Allied Health for Mental Health in southwestern Sydney. I started in 2003. I went to Western Sydney University and did a Masters in Clinical Psychology. So I started working with early psychosis at the time. From there I went through to adult psychosis, and it was just a bit of a trajectory into management. I became the service manager for Liverpool, and then from there the Director of Allied Health. You know, lots of people have this idea that mental illness is things like schizophrenia or things like bipolar. I think mental illness is really not coping. If you are not able to cope in your day-to-day life, or are having trouble doing the things that you like doing, or doing anything really in your life that can get you ahead, I think that is illness. I don't really like the term illness. I think that that gives you a real differentiation between illness and wellness, and I don't really agree with that. I think that we all fall on a bit of a range, and sometimes we are able to get along better than at other times. I think mental well-being is something that's really important to everybody, and I think it's about looking after yourself, and I think it's about knowing how to recognise the signs of you not doing so well, and then being really conscious of helping yourself on the right path, and recognising that, hey, today I'm not doing very well, what do I need to make myself feel better? But if you're really worried about somebody, or really worried about yourself, or don't feel safe, then I would suggest you call the Mental Health Access line, because somebody will call you and talk to you about your problems or issues that you have, and we can see what we might be able to do to help. Sometimes people tell you stories that are very hard to get out of your mind. When I'm driving home from work, if I find that I can't stop thinking about it, there's a little roundabout that I have near my house that I'll sometimes just go around 3 or 4 times and think, I can't take this home. I've got my own children, I've got a partner at home, I've got people that really don't need to be exposed to me not doing so well. So I drive around and around the roundabout until I've cleared my mind. I do a lot of painting and drawing. It's almost like a meditation. So if I'm feeling particularly over-connected with work and need to just unhook my brain, I'll go to my artwork and I'll do some painting. Some of our jobs are particularly stressful, particularly I think mental health workers. This idea that mental health workers have it all together is not right, and we need coping skills as much as everybody else does. We have the Mental Health Access line, which would be the best way to access mental health services. The number for that is 1800 011 511.